Welcome to our comprehensive guide on cardiovascular keywords and definitions. Let's dive in. Aortic stenosis, a crescendo-decrescendo systolic murmur radiating to the carotids. Aortic regurgitation, an early diastolic decrescendo murmur. Mitral stenosis, characterized by an opening snap with a diastolic rumble. Mitral regurgitation, a hollow systolic murmur radiating to the axilla. Mitral valve prolapse, identified by a mid-systolic click. Tricuspid regurgitation, a murmur that increases with inspiration. Hypertrophic cardiomyopathy, a murmur that increases with Valsalva maneuver. Dilated cardiomyopathy, systolic dysfunction with ventricular dilation. Restrictive cardiomyopathy, impaired ventricular filling. Arrhythmogenic right ventricular cardiomyopathy, fibrofatty RV replacement. Infective endocarditis, characterized by vegetations on valves. Rheumatic fever, associated with Aschoff bodies. Acute pericarditis, presence with a friction rub and diffuse ST elevation. Cardiac tamponade, identified by Beck's triad. Constrictive pericarditis, pericardial calcification and Kussmaul sign. Myocarditis, inflammatory myocardial injury. Acute coronary syndrome, plaque rupture with thrombosis. Stable angina, exertional chest pain relieved by rest. Prinzmetal angina, caused by coronary vasospasm. Myocardial infarction, ischemic necrosis of myocardium. Transmural infarct, full thickness wall involvement. Subendocardial infarct, inner third to half of the wall. Troponin, IT, the most specific MI marker. CKMB, useful for reinfarction. Reperfusion injury, characterized by contraction band necrosis. Dressler syndrome, post-MI autoimmune pericarditis. Papillary muscle rupture, acute mitral regurgitation after MI. Ventricular free wall rupture, tamponade after MI. Ventricular septal rupture, post-MI VSD. Mural thrombus, embolic risk after MI. Left-sided heart failure, causes pulmonary edema and orthopnea. Right-sided heart failure, leads to peripheral edema and JVD. HFrEF, heart failure with reduced ejection fraction. HFpEF, preserved EF with diastolic dysfunction. S3 heart sound, indicative of volume overload. S4 heart sound suggests a stiff ventricle. Pulmonary edema presents as pink frothy sputum. Orthopnea, dyspnea when lying flat. Paroxysmal nocturnal dyspnea, sudden nighttime dyspnea. BNP, a marker of ventricular stretch. Atrial fibrillation, an irregularly irregular rhythm. Atrial flutter, characterized by sawtooth flutter waves. AVNRT, re-entry near the AV node. WPW syndrome, accessory pathway with a delta wave. Ventricular tachycardia, a wide complex tachycardia. Torsades de pointes, polymorphic VT with prolonged QT. Ventricular fibrillation, disorganized ventricular activity. Asystole, a flat line with no electrical activity. Pulseless electrical activity. Rhythm without a pulse. First-degree AV block, a prolonged PR interval. Mobitz I, progressive PR prolongation, then a dropped beat. Mobitz II, dropped beats with a constant PR interval. Third-degree heart block, complete AV dissociation. Sinus bradycardia, SA node rate under 60. Sick sinus syndrome, a dysfunctional SA node. Premature atrial contraction, an early abnormal P wave. Premature ventricular contraction, an early wide QRS beat. Electrical alternans, beat-to-beat QRS variation in tamponade. Pulsus paradoxus, exaggerated drop in systolic BP on inspiration. Pulsus parvus et tardus, weak delayed carotid upstroke in AS. Essential hypertension, no secondary cause identified. Hypertensive emergency, severe BP plus end organ damage. Secondary hypertension, due to renal or endocrine cause. Aortic dissection, tearing chest pain radiating to the back. Marfan syndrome, cystic medial degeneration of the aorta. Abdominal aortic aneurysm, infrarenal dilation. Thoracic aortic aneurysm, mediastinal widening. Coarctation of the aorta, upper extremity hypertension. Takayasu arteritis, known as pulseless disease. Giant cell arteritis, temporal headache, jaw claudication. Polyarteritis nodosa, transmural necrotizing vasculitis. Kawasaki disease, coronary aneurysm in children. Buerger disease, thrombosing vasculitis in smokers. Raynaud phenomenon, episodic digital vasospasm. Deep vein thrombosis, a venous clot in deep veins. Pulmonary embolism, a thromboembolus to pulmonary arteries. Virchow triad, stasis, endothelial injury, hypercoagulability. Varicose veins, dilated superficial veins, chronic venous insufficiency, edema with stasis changes. Superior vena cava syndrome, facial swelling, venous congestion. Atrial septal defect, fixed split, S2. Ventricular septal defect, holosystolic murmur at LLSB. Patent ductus arteriosus, a continuous machine-like murmur. Tetralogy of Fallot, presents as a boot-shaped heart. Transposition of great arteries, parallel circulations, truncus arteriosus, failure of truncal septation, total anomalous pulmonary venous return, pulmonary veins drain abnormally, tricuspid atresia, a hypoplastic RV, Epstein anomaly, apical displacement of the tricuspid valve, endocardial cushion defect, AV septal defect in Down syndrome, cardiogenic shock, pump failure causing hypoperfusion, hypovolemic shock, low preload and low cardiac output, distributive shock, characterized by low SVR, obstructive shock, impaired cardiac filling or outflow, jugular venous distension, elevated right atrial pressure, ejection fraction, the fraction of end diastolic volume ejected, preload, ventricular end diastolic stretch, afterload, resistance against ventricular ejection, contractility, intrinsic strength of myocardial contraction, cardiac output, heart rate multiplied by stroke volume. Thank you for joining us on this journey through essential cardiovascular terms. Stay healthy and keep learning.